This is Barbara Reese reporting for This Week in East Brunswick. We're here at the East Brunswick Public Library for a very special Health Literacy Day, just for the health of it. Come join us. Tell us, Karen, a little bit about how this came about.
Well, we realize, Barbara, how important the public library is in helping people to understand health conditions and how the library is really the front face to the community for people that need help navigating a very complex system where information is so hard to find on the internet, and there's so much of it around, it's hard to evaluate. So we started our Just for the Health of It initiative 2 years ago to help people navigate the plethora of information that's out there, and we have since grown into a wonderful opportunity for the public library to really be the face of health literacy. Health literacy is really defined as the ability to read, understand, and act on basic health information. We know that there are 90 million people in the U.S. that are health illiterate, meaning that they can only understand health information at a 5th grade level. We are very proud that our library is an affiliate member of the National Libraries of Medicine. Our librarians are very enthusiastic, warm, and interested in learning. They take classes constantly to improve their health literacy skills so that we're always directing people to the most accurate sources of health information.
Now, today is a special day because you actually have tables out geared to certain areas of health. Could you tell us a little bit more about those tables?
Sure, Barbara. We are very excited that we are partnering with Robert Wood Johnson University Medical School to bring medical students on site to actually bring health literacy here to the East Brunswick Library, where they are learning to communicate with patients in what they call living room language, bringing language down so that the patient or our future doctors can make health information understandable for the elderly, for new immigrants, where they develop sympathies and empathies towards those of different cultures, for people of different languages, different age groups. And so the medical students are here, and our consumer health librarians have provided a wonderful array of articles from excellent resources that they've learned about through their training at the National Library of Medicine on many different health topics.
The program has been growing exponentially since then because people care about their health, and the cost of health care is so astronomical that it really pays to stay healthy. And that is what today is all about. It's doing preventative care, it's knowing, being able to ask questions. We have a tremendous partnership with the Robert Wood Johnson Hospital, and this is the medical school today. The hospital got us hooked up with the medical school, and these are young medical students that have come here really to learn how to talk to consumers, health consumers, and it's been a wonderful partnership so that our customers that come in can ask about different ailments or how to stay well, talk about immunizations, emotional health, and ask the students questions. And the partnership is that the library provides quality health information, and the students are able to use that information to talk to the customers. So it's been a wonderful day. It's a partnership that they would like to repeat this again. They're very enthusiastic about, and we have actually taught the students that libraries are places of information. So it's a win-win all around.
So the good thing about today is that it's in a library, which I think is very different from being in a hospital, because there's something called white coat hypertension. And it's a thing that we all know about, that once we're with a doctor and they're in front of us, we get scared because they have this big higher position. But that's not necessarily the case with the students. We're not at that point yet. We're still connecting with people, and we still want to talk to them and understand what's going on with them.
This is my first time, and I think it's great because I think about before medical school, or before I was comfortable with any of these terms, and I had a lot of questions. And I think it's important because it empowers people to be their own advocates, to understand their own health. And that's what so much of health is compliance and understanding on the patient level, on the individual level. So I think it's been great. It's been an awesome experience. I would definitely do it again.
Oh, I would say there's no shame at all in asking questions. That means that you're thinking, and that means that you want to know what's happening in your body and why people are suggesting to eat certain foods or, have certain vaccines. So I think you should never be afraid to ask questions. That's what we're here for. That's what your physicians are there for. And it's very important to understand the reason behind certain advice.
We are about lifelong learning. We are about people pursuing their passions, learning something new, and consumer health is a huge area. We started this Just for the Health of It initiative because the questions that we were getting at the reference desk were people were coming right from their doctor's offices, and they were like, oh, I just got diagnosed, or I just got this new medication and I don't know how should I take it, how does it react. As we all know, doctors are under tremendous pressure time-wise, so we are the people that really back up the doctors and help them educate their patients, and also make sure the patients follow their directions, so that we don't, obviously we're very careful, we don't tell people what's wrong with them, we educate them so they can ask their doctors important questions. So that's what this is all about.
We know that health illiteracy leads to more hospital readmittances, longer hospital stays. It's a big drain on the system. It costs the system anywhere between $150 to $300 billion a year that is lost or wasted on people that don't follow doctor's orders because they don't understand, they don't know where to find information, they can't evaluate the information, they don't know what questions to ask their doctor, and oftentimes leads to more inaccurate diagnoses or delayed diagnoses in very urgent conditions. So what an opportunity for the public library to really be on the forefront of helping people to know that they can come to us to get reliable information so that they can communicate effectively with their doctor or healthcare professional.
In the last couple of years, I had a medical issue that the doctors could not solve. They helped me identify by using the Mayo Clinic database, the NIH database, and I was able to show my neurologist that my condition was caused by a drug that's used to lower cholesterol. And I wrote a paper called Drug Toxicity is the Etiology of Disease. And even though I was admitted to St. Peter's Hospital and they thought I had sudden onset Parkinson's, or they thought I had water on the brain, I had really a drug-induced disease due to a lower cholesterol-lowering agent. Also, when they put me on a drug for Parkinson's, I developed worse complications. I went to the library afterwards. I stopped the medication with the concurrence of my doctors. My symptoms went away, and they do tremendous searches here. I consider this library to be a 5-star library, the best in the state.
Well, consumer health librarian is someone that we have additional certifications, and we're able to help research health questions, health or wellness questions that anybody may have.
And you have a special department here just for the health of it?
Just for the Health of It is our health initiative at the library, and it's a service where we have resources designed for consumers, and then we're also able to custom research health and wellness questions for people that come in and submit questions to us. So we do the research, we package the information, and we send it back to the person. It's also kept at a level that's understandable. We don't, unless they request it or need it, we don't send out clinical information. A lot of times we're giving people the vocabulary for them to take back and be able to ask their doctors questions.
I think the people feel very empowered because they have learned much more about their disease or problem. And sometimes, the doctors are throwing things at you and you forget to ask certain questions when you're in front of the doctor. And then when you go back home and you say, I should have asked that question. And now you have some information that you can base a question on. So I think that helps them.
I think it helps them to understand what the doctor has said. And as Renu said, they're scared to ask the doctor questions, or they don't remember and they get home, oh my God, what did the doctor tell me? And they come to us and we're able to find information on their level of understanding, whereas the doctor may have said something that's more technical, and we can break it down into a manageable format for them to understand what the condition is, maybe what the treatment is, what to expect, kind of sorting out the information.
Our first approach is to, make them very comfortable, bring them to the level, provide them a comfort zone. So start with very basic information, background information, and provide them either the print material that they can read. Usually, we give them the literature and ask if they understand. And based on that, we kind of determine their comprehension level and then provide more detailed information. So it is very interactive approach. And the first step always is to make them very comfortable.
We have a partnership with Robert Wood Johnson where we have desks at their wellness, fitness and wellness centers, one location in New Brunswick, one location in Old Bridge. And there we have a table sort of, again, very similar to a reference desk, but just at a wellness center. And people come up and we have some literature on hand, but they also ask us their questions. And we bring those questions back, we do the research, and similarly, we send it out to them. But it's nice because it provides them a different way to access the library. In busy schedules, not everybody can physically walk into the building, but people are now, in order to take care of their health, are making time to maybe go to a gym. And in some cases, they're there for perhaps rehab services or other classes. And we're able to help supplement that by providing the research services.
We've had over 500 hours of research that we've done since we started our partnership in April of 2013. So it's an enormous amount of research that we've done. Health literacy has been declared a national movement by the Surgeon General. It is a big and important issue to the next generation of health care, and it's a collaborative effort. It requires not just the hospitals, not just the doctors, but the community. And of course, what better place than the heart of the community, the public library.
This is Barbara Reese reporting for This Week in East Brunswick. Hope you've enjoyed this fun and informative Health Literacy Day. Thank you for joining us.